As we heard from Dr. D. Michelle, some patients, particularly those with very early stage breast cancer, have options to manage their risk of recurrence. Michelle Beck was one of those patients.
I started doing mammograms at age 37, and on my fourth one at age 41, I got that dreaded call where I had to go back. And then a few days later, on December 7th, I heard the words, "You have breast cancer." So that date will forever live in infamy for me. I am very lucky. I was diagnosed early, thankful to my mammogram, stage 1, grade 1, ERPR positive, HER2 negative, quote unquote, the best kind of breast cancer, even though it is all really horrible. But I was very fortunate in the fact that I had choices. But let me tell you, at that point, when you are diagnosed, your brain explodes and you don't want any choices. I did at that time go ahead and choose to have a lumpectomy with radiation. And then I did 4 years of tamoxifen, kind of put it behind me. I had a young son at the time. I was very busy with my family. And lo and behold, 4.5 years later, I was diagnosed in my other breast. So I had a new primary occurrence in my other breast.
As someone who has been diagnosed with early breast cancer twice, Michelle has had to face several different crossroads where she's had to weigh the risks and the benefits. She shared with us some of the most difficult decisions that she had to make during her breast cancer journey.
I was debating getting genetic testing, the BRCA test, because at the time I was diagnosed in 2012, it was so expensive and a lot of insurances did not cover it. However, since I had a family history, we decided, yes, to go ahead and get the testing done because I was still really unsure of what I was going to do treatment wise. I did find out that I am BRCA negative. And then when I got those results back, I had to actually make a decision about my treatment plan. I was really not that I was hoping to be BRCA positive, but I wanted someone to make the decision for me because when you first hear those words, literally rational thought goes out the window. And having someone to help or something to help with those decisions is life changing. So I did finally opt to have a lumpectomy and radiation because at the time my son was not even 2 years old. And I'd waited a long time to be a mom and I wanted to just kind of get treatment over with and move on. I was told that my survival rates were the same, whether I went with lumpectomy versus mastectomy. And that seemed like a pretty good news to me. So I went the easier route. Looking back on it now, it might have been a change that I would have made if I knew I was going to be diagnosed in my other breast. But at the time, that decision was right for me. But it was really hard to make. One other hard decision I had to make was after my second diagnosis, they gave me an oncotype test, which I did not have that the first time around. But with the mastectomy that I did, both sides, removing my ovaries, which gave the dreaded estrogen, I felt comfortable and confident in that decision that I wanted to forego chemo because honestly, I was scared. I didn't want to go through chemotherapy if I didn't need to. And my doctor was very on the fence. I worked with my doctor on all of these major decisions, and that one was left up to me. And then the next biggest decision was how long do I need to continue on the aromatase inhibitors?
Michelle was taking aromatase inhibitors after her second diagnosis, but she suffered debilitating side effects from them. She explained to us how she worked with her doctor to determine how she could best manage her risk of recurrence while still maintaining a good quality of life.
The worst for me was the joint pain. My knees, my hips. I would have pain in my hands and my feet, like the palms, and they would just ache and throb. I would be sitting at night just rubbing my hands together, trying to do anything to stop the pain. I couldn't even walk my dogs down the street because it hurt. And I cannot express the lack of quality of life I was having due to the hormone medication. So I found the breast cancer index test on Instagram and I saw this come up in my feed and I met the parameters and it was like, do you need more hormone therapy? I'm like, in my brain, I'm like, God, no, I do not need any more of this hormone therapy. And I met the parameters. So I had gone in to meet with my doctor because I wanted testing. immediately. So we ordered it and I waited on pins and needles and I did research and it's super easy because they just go back to the hospital, find whatever little tumor sample they have from your biopsy, and they get it in, get you the results. And I was anxiously awaiting the results. I'm like, "Oh, please tell me, please tell me." And when I got them, I sobbed in sheer relief.
The results from her breast cancer index test showed that Michelle only had a low risk of recurrence at just 2.9%. And after discussing these results with her doctor, they decided together to discontinue aromatase inhibitor treatment. The breast cancer index test is one of several tumor profiling tests that are available to predict a person's risk of recurrence for those with early breast cancer. They are all prognostic, which means that they provide an estimate of the likelihood of breast cancer recurring. But some tests are predictive, meaning the results of the test indicate the course of treatment that is best for the patient.